Good evening to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by your keynote speaker, Doctor, for today's session. With much pleasure and honor, let me welcome our very renowned doctor, Dr. Dharini Krishnan. Ma'am is PhD, RD, consultant dietary in Chennai. With the help of ma'am, and her wonderful insight, we will be taking a close look on today's topic, which is iron deficiency and anemia in women, newer approach in dietary correction and supplementation. Now, without any further delay, I would like to welcome ma'am again at our forum and would like to hand over the session to her. Over to you, ma'am.
Thank you so much for this opportunity to IGDC and to you for inviting me here. The topic chosen today is iron deficiency and anemia in women, newer approaches in dietary correction and supplementation. Anemia is such a thing that it rocks the globe and it hasn't been fully eradicated, or even we have not got big strides in it so that we could talk about anemia being away from the countries which are developing countries. But it's funny to know that it is also there in many non already developed countries too. I remember my teacher telling me that as a student, she would see anemia and she would dream of one day when anemia would be eradicated. The same journey I also thought it will happen in my lifetime, but it's still yet to happen. So, what is this anemia and why are we so worried about it? We are going to talk about iron deficiency anemia because there are various types of anemia, but we are going to concentrate on iron deficiency anemia. So, what happens in this anemia? It is a condition marked by a deficiency of red blood cells or of the hemoglobin in the blood, resulting in pallor or weariness. There are many people when they get up in the morning, they've had a good night's sleep, but they feel tired. A lot of people come and tell us we lose a lot of hair when we have a hair wash. So, what are these? These are symptoms of being tired early in the morning. We are losing a lot of hair and always feeling listless. These are all related to iron deficiency anemia. So, the easiest way would be to check a hemoglobin, where one of my colleagues, as a student in MSc, did this, and they checked the hemoglobin of people and then they tried to help them get over this problem. So, when we talk about hemoglobin, it has two things which are attached: heme, which is iron, and globin, which is protein. So, if you are deficient either in iron or of protein, the hemoglobin will come down. And hemoglobin is very, very important for our body because this is the one which carries oxygen to different parts of our body, and not only oxygen but many more other things. So let's take a look at a map where preschool children by country, how many of them are suffering from anemia. And when you see the dark red, it is severe anemia, and it is there in South America, Africa, a little bit in the Middle East, and lot of it in India. Where are we? We have a lot of it. We have almost 90% of the country where the preschool children are already severely anemic. Why are we going to talk about children also when the topic is women? You will get to know as my presentation continues. So, in anemia, what happens? The number of RBCs and consequently the oxygen carrying capacity goes down, and it is insufficient to meet the body's physiological needs. If one doesn't get enough oxygen to the cells, then obviously the body is going to feel very, very tired. The function of RBCs is to deliver oxygen from the lungs to the tissues and carbon dioxide from the tissues to the lungs. So, when this does not happen properly, and the amount of oxygen is not delivered to all our cells, including our brain, then we are going to be in trouble. So, what are the adverse effects of anemia? If you see, reduced physical development, which leads to decreased work output, decreased work capacity, impaired sexual and productive development, irregular menstruation, low pre-pregnancy iron stores, LBW or low birth weight babies, and preterm delivery. So these are the very, very important points to note, because if you have irregular menstruation because of anemia, then there is going to be problems of getting pregnant. And the low pre-pregnancy iron stores affects the baby, and that affects the child, and that affects the adolescent who is going to become an adult. And when that adult girl becomes a low iron store, she starts her journey and she goes into pregnancy, then it's deep trouble. That is why we're including to show you how many children, adolescents are also severely anemic. So, reduce of cognitive development, diminished concentration, disturbance in perception, and poor learning ability. So, this is why, though the population of India is huge, there is lot of trouble because of anemia. Before, it used to be more in the lower income groups, but it also has started affecting the upper middle class and the high class society, because people are not eating well. So, prevalence of anemia in different age groups, when you see this slide, from months it's 79% because the mother's iron is coming to the baby through breast milk, and 6 to 59 months it starts dropping, and in women 15 to 49 years it's only 55% who have anemia, which means only 45% are healthy. Even in married women, 56% have anemia, and in pregnant women, 58.7, and in lactating women, 63.2% have anemia. Now, what does this mean? Why is it more in lactation? Because of the loss of blood during delivery, they tend to fall lower, and hence more people become anemic. And this can be very dangerous, because then the iron requirement, which is excellent in breast milk and bioavailable, will not reach the child unless the mother's body muscle is taken out and iron is pulled out of the organs, which is not good for the mother. So this is very, very important. And when you look at adolescents, it is like 12 to 14 years, it's 68% who are anemic. 15 to 19, it's almost like adult, where 55% are anemic. So, what are the causes of nutritional anemia? One is insufficient quantity of iron-rich foods and iron enhancers in the diet, which is food rich in vitamin C, such as citrus fruits, and low bioavailability of dietary iron, which is foods containing only non-heme iron. So when we talk about diet and iron, there are two types of iron, the non-heme iron and the heme iron. The heme iron comes only in the non-vegetarian foods. So those who are vegetarian have to depend on the non-heme iron. But the problem with the non-heme iron is it also comes with a lot of anti-nutrients for iron absorption, like oxalates and phytates, and hence the low bioavailability. That means our calculation in the diet may show enough iron, but how much is exactly getting absorbed? This is something we don't know. But we know that because of these anti-nutrients, there is a lot of iron which is not getting absorbed, though it is there in the diet. So excessive quantity of iron inhibitors in the diet, especially during meal times, like tea, coffee, and calcium-rich foods, these can interfere with the iron absorption. Like everybody comes and tell us, why can't we have a coffee or tea after breakfast? This should not be had. It should be before half an hour or after about half an hour to 1 hour. After any meal should be tea or coffee, because if you have it with the meal, it will actually interfere and with the iron absorption which is present in the meal. If you take the breakfast of a Westerner, they normally have a bakery item which is only fortified iron. But in our country, we take fresh foods for breakfast, which is prepared freshly. Even our curry leaves have iron, and there's so many products. Like if you make out of ragi, there's iron. If you make out of millets or whole grains, or if there's a black bean or a red bean or a black urad dal, the iron is there. But if you take your coffee, tea along with such a meal, the iron absorption will be much less. So, iron loss during menstruation, if somebody is already anemic and if they have lot of bleeding during menstruation, they end up losing more iron. Poor iron stores from infancy, childhood deficiency, and adolescent anemia. This is what I was discussing. If the mother is deficient, then during lactation, there are more people who are anemic. Then, in that beautiful period of 0 to 6 months, when the child is exclusively breastfeeding, when the mother's iron, which is more bioavailable, is not reaching the child, because the mother itself is anemic, how much can the body produce iron to give it to the baby? So that leads to childhood deficiency, and that leads to adolescent anemia, which carries on to adult anemia. So iron loss from postpartum hemorrhage is a big problem, and because of that, they could have more people anemic with lactation, because during pregnancy, they lost a lot of iron. Increase iron requirement due to tissue, blood, and energy requirements during pregnancy, which is why we give them iron supplements, which are given through the primary health centers, which people need to take in the lower income group. But because when they take the iron supplement, their stools become black, they get scared, and they are not taking it. So today, there are a lot of government programs which enthuse them and tell them that this is not wrong and they need to take the iron tablets which are provided to them. Teenage pregnancy is a problem. Repeated pregnancy with less than 2 years interval, which can lead to the mother being more anemic, and then the fetus, and then the child born is going to already be anemic when they are born. Iron loss due to parasite load. This is one malaria, intestinal worms, which remove the iron from the body. Malaria breaks the RBCs, so your iron is not available to you. The RBCs are not working properly, and poor environmental sanitation and unsafe drinking water, which leads to worms and other things in the food, which can lead to loss of iron. So what can anemia do? Why are we talking so much about anemia? 20% of maternal deaths are due to anemia. Reduce energy in women and capacity to work, it's because of anemia. Growth retardation or intrauterine growth retardation in the fetus. That is, in the uterus itself, the growth is not happening properly, could be because of anemia in the mother. Low birth weight are due to anemia. So it's internal growth, intrauterine growth retardation, or low birth weight after the child is born is due to anemia in the mother. Premature delivery, perinatal mortality, increased risk of death during delivery or post delivery are problems that are related to anemia. So, if we can control and reduce anemia, we can help in all these aspects of pregnancy and postpartum issues. So, what did India do? We took up the Mukt Bharat initiative, Anemia Mukt Bharat, And they started this program of National Iron Plus Initiative, where bi-weekly iron supplementation were given to preschool children, weekly supplementation for children 1st to 5th grade in government and government aided schools, weekly supplementation for out of school children who don't come to school but come to Anganwadi centers regularly. So 5 to 10 years, those children are also taken care of. And weekly supplementation for adolescents 10 years to 19 years, so that if anemia is corrected in the early age, then by the time the woman becomes an adult and is married and is getting pregnant, hopefully the anemia will be out and pregnancy and lactation will be smooth. Because in pregnancy, the blood loss they can take care of, and lactation, the mother will have enough iron so that the baby will get correct iron. So we have to start from the younger age and correct till the older age. Only then it will work better, so that 5 years from now, India will be anemia mukt Bharat. Now, weekly supplementation of women in the reproductive age is also very, very important. Now, interventions to prevent and correct iron deficiency anemia is that strategies for prevention and control of iron deficiency and iron deficiency anemia. So, if you can prevent at iron deficiency stage itself, it is better. But if it becomes frank anemia, which is very low levels, then we need to do better. So, food based strategies are dietary diversification to include more of iron rich foods and include vitamin C, which helps in iron absorption in the same meal. And food fortification is the next one. Supplementation and improved health services, which we are already doing. So, what does the dietary diversification mean? It means micronutrient rich foods, and we are concentrating on iron here. So, dark green leafy vegetables which contain iron, lentils which have protein. So, it can be the dals also, it can be whole pulses also, it can be red colored like rajma which has more iron, or it can be the whole pulses like ragi which has iron, and vitamin C rich fruits, basically amla, which is very affordable to most people, can be taken with the green leafy vegetables. And if this can be taken between meals as a soup of green leafy vegetables with vitamin C, amla ground into it, at 11 o'clock or 3 o'clock or 6 p.m., this will help in better iron absorption. Food fortification and supplementation. Fortification is in processed foods used by the population. Like we have many examples where you know that iodine has been put into salt because to prevent iron deficiency. There are iodine deficiency. There are a lot of people who are talking about it, but there was a double salt fortification where iodine and iron was fortified in salt, but that didn't take off in a big way. Supplementation can be taken in all economic groups to prevent iron deficiency. So, what is it? What is the IFA? That is the iron and folic acid for preventing anemia. So, IFA is iron and folic acid supplementation. It's a government initiative where in children they are giving a syrup of iron and folic acid containing 20 milligram of elemental iron and 100 mcg of folic acid, and tablets for the bigger children which contains 45 milligrams of iron and 400 milligrams of folic acid, micrograms of folic acid. Sorry. Then 10 to 19, which is the adolescent period, and very important to correct because they've started their periods. We don't want them slipping into iron deficiency. So there also they give supplementation. It is given to pregnant and lactating women and women of the reproductive age. So everyone should be enthused to take what is given to them, and then it is a better program. So what are the foods rich in iron? India has the highest biodiversity of green leafy vegetables. We have 16 to 18 varieties, and all of them are rich, whether whichever green leafy vegetable, including the carrot leaves or beetroot leaves, which people have started using today, the black sesame seeds, the ragi, the beans itself, the Brussels sprouts, a little bit in the tomatoes, the green peas, and mainly the green leafy vegetables. So, what are we missing out? We have a diet which is affordable as green leafy vegetables, but we are not being able to prevent or improve the anemic status. The reason is in the non-heme foods, as we explained, they have phytates and oxalates. So, how can we reduce the phytates and oxalates in the vegetarian food, which can improve iron absorption? So when you're talking about beans to reduce phytates, you can soak them basically, whether it's the rajma or the black beans or the sesame seeds. We can soak them, sprout them, or ferment them, and this improves iron absorption because it reduces the phytates. Lentils soaking or sprouting can help, and whole grains fermentation can lower phytate levels. That is why the black rice, which is being used today, they have to use it as a cold rice. Then it's even better because the fermentation can reduce the phytate levels and help us absorb iron. Oxalates, spinach, beets, all the green leafy vegetables have it. You cook it and take it, and then it reduces the oxalates. But what are we doing today? People take spinach smoothie. They are not even cooking the spinach. It is raw spinach, which has a lot of oxalates. Then the iron does not get absorbed. So the better way would be at least to steam it a little and then use it. Then it is better because the oxalates will reduce and the iron absorption will be better. So, what are the combinations we need to do? Vitamin C, it can be had with iron rich foods for better absorption and between meals. Amla is an excellent example. Citrus fruits and lime. Amla is not available 12 months in a year. You can cook it with a little bit of salt and turmeric, and then it can be used along with foods throughout the year. The BPO sector people needed blood transfusion. I was working with them. They were so anemic that some of them needed blood transfusion. So look at the anemia prevalence in women across states. This is 2021 data, but it's not much better in 2025. Look at the numbers 53 to 60 to 65%, which is a huge number. And who all are the targets of Mukh Bharat? Lactating women, pregnant women, women of reproductive age, children, as I told you, adolescents, even boys and girls, to prevent. And the target is to reduce from around 50% and odd to 11% and 32 or 35% in pregnant and reproductive age. In boys, it starts less because they don't have menstruation. 29% at least make it 11%. So this is what they're working from 2022. Thank you very much for the opportunity, and I'm happy to take any questions that the audience has.
Thank you so much, ma'am, for this wonderful presentation. We do have some question if you like to take that up. So, ma'am, the first question is, what are the most common dietary pattern in women that uh, predispose them to iron deficiency?
The most common practices is tea and coffee along with your meals, which is not good at all. You need to give a gap between your meals and the tea coffee you take because tea and coffee have tannins which actually interact and does not allow the iron to be absorbed. And when you take iron rich foods, you please take it between meals along with vitamin C, as I told you in the presentation, because that will help you in a very big.
Another question which we have, ma'am: how should dietitian address myths about iron-rich foods? Example: spinach versus meat source, tea or coffee reducing absorption.
It's not a myth, it is the truth. Spinach is good. Garden cress seeds are excellent. Sesame seeds are very good. But everybody can't take so much of sesame seeds because it can create some gut issues. And for some people, it can increase the bleeding also. So we can take in small quantities, we cannot take in large quantities. Black urad dal can be used, garden cress seeds can be used, but that is not in our normal diet. So to make somebody take something which is not normal is difficult. If it is very low, if your hemoglobin is below 10, you need to take medical help and take supplementation. The supplements should be taken between meals, either early morning in empty stomach or 11 a.m. or 3 p.m. or 6 p.m. and with vitamin C. And then the absorption is better. You can bring it to normal. Then you can maintain with spinach and other things so that it doesn't drop back to lower levels.
One last question, ma'am: what role do functional food plays in iron correction for women?
Functional foods, the superfood amla is one of the best example. Next is moringa, which is rich in iron, but just make sure that moringa is cooked and eaten. You should not eat raw as a capsule or as a powder which is just dried. You must cook it before you eat it because as we saw, the spinach contain phytates and you need to, oxalates, and you need to cook it to reduce the oxalate content. So it should be cooked. And even amla, raw everybody cannot take. You cook it and take. It has a lot of vitamin C. By cooking, little is lost. It's okay. Still we get enough.
Thank you so much, ma'am, for answering all our questions. That's all from our audience, ma'am. Before concluding, any take-home message?
Take home messages, please. Anybody in your family who has anemia, including you, correct it first. And that is very, very important because you have that depends the health, the oxygen carrying capacity itself is through RBCs. That is red blood cells. So please make sure your family is anemia mukt, and that will be a great step forward.
Thank you, ma'am, for joining
Thank
us
you.
today, and thank you for conducting such a wonderful session. It's our pleasure to have you here, ma'am. Thank you.
Thank you. Thank you for the watch. Bye bye.